Welcome to another episode of Ask Dr. Martin, where I answer your mental health questions. I am so excited about this series. This is not meant to be a substitute for a relationship with a licensed mental health professional, but let's start with the next question. Grief is real. Any advice on coping with the passing of parents? How does one cope with the loss of both parents in less than a year? Where or how does the healing begin? So first of all, I'm incredibly sorry for your loss. The impact of grief overall can be incredibly debilitating, and it is certainly not a linear experience. There are no set steps that you go through when it comes to grief. Like the 5 stages of grief: denial, anger, bargaining, depression, and acceptance are typically not used in an appropriate manner or referenced in an appropriate manner, but that's a whole different post. When it comes to grief, some days you may feel okay, and other days you may feel like a wave of emotion hits you from sun up to sundown. Every single one of those feelings are valid. The whole range. The feelings will change, they will wax and wane, and that's normal. If your parents were in pain towards the end, you may also feel a sense of relief that the pain is no longer present, guilt for feeling that relief, and then anger and sadness over the loss of their life. Caregivers are most salient relationships, and because of that loss of that magnitude, it may shake the bedrock of who you are. I believe that healing is happening every single second of the day. So you are already healing, and no one can decide what that looks like but you. There is no appropriate set of time for you to be in a less painful place. Your body, your mind, your spirit, that dictates how much healing happens each day to day. And I don't think losing someone is something that you heal from. I think of it as something that will be with you for the rest of your life, and you decide how you carry that. It doesn't mean that your life should stop. It does mean that it could mean that a new you and a new life begins, because we're the result of our experiences. And now this is one of your experiences. Some tips I would say is take time to honor your parents in a way that feels genuine to you. No one else has to understand, appreciate, or even agree with it but you. Utilize the support that is offered if it is offered to you. And if no support is offered, look for additional resources like therapy or support groups or even online communities. Also, be aware that you will likely feel like you are walking through mud most days. Like having difficulty paying attention, completing tasks, maybe even just completing thoughts. That's because your brain only has the capacity to deal with like so many things within a day. So when you're grieving, that's taking up a good amount of your cognitive energy. So take extra care to attempt to self-monitor key things like sleep, eating, water and hydration, activity level, and even substance use. Maybe get a bigger water bottle and know that you have to finish that once a day instead of thinking about refilling it. Your capacity for things like activities of daily living, which are things like hygiene and cleaning and eating, will decrease. So think of some accommodations to help you while your mental energy is being used in different ways. Paper plates, dry shampoo, protective hairstyles, an extra hamper, all of that. I know I threw a lot of you, so take what helps and leave what doesn't. Please, 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 please try not to talk bad to yourself or be too hard on yourself because things are taking longer to complete or your attention span may be different. Please realize that your body is serving you in the best way it can. And it really doesn't matter what it used to be able to do at this point. What matters is what you need right now to best serve yourself. So don't think about, I used to be able to do this quicker. I used to be able to do this easier. Don't think about that. Think about what you need to accommodate you right now, because that's what's most important. I hope this helps. Thank you so much for sending a question in. If anyone else wants to send a question, send it to askdrmartin@raquelmartinphd.com, and it may be answered on the show. Follow me, subscribe, like, comment, share on all of that on Instagram, TikTok, Facebook, and of course YouTube, because Ask Dr. Martin will only be available on YouTube.